might as well introduce myself a bit as well. My name is Lars Langøien, or Lars for those who prefer English. And I've been working at the National Institute for Public Health for the last, I think it's been 7 years almost. And I'm a PhD in social anthropology, so I have moved quite away from that into doing systematic reviews. But as we will see in this presentation, we also do a bit of primary research, which takes me a bit closer back to home. So I'll start, and feel free to ask questions along the way as well. And Rigmor has promised to keep an eye on the chat if there's anything, and stop me if there's something that seems very strange or that doesn't add up. Otherwise, there will be some time for questions afterwards as well. And let me know if I spend too much time. I would like to have time for the discussion afterwards. So let's see if this worked earlier, so hopefully it will work now as well. Then you will hopefully see my presentation. So the topic for this webinar is information and support services for children 9 to 12 years old. And in particular, I will be looking into how we can supply and combine supplement systematic reviews with primary research and combine the two. Let's see if I can make this. Yes. So I will present an example of how primary studies, and in this case, service mapping or mapping services can add to and supplement to systematic reviews, and especially when there are very few research studies meeting the inclusion criteria. But I will have main focus on the topic, which is information and support services. And then I will kind of highlight where the different approaches added to each other. So we were commissioned to identify and contribute to the evidence base on information and support services for children between 9 and 12 years old in Norway. That is, in this case, services that children themselves could turn to in person or digitally. And this evidence were to contribute to the work on developing such services, because we have services targeting children and youth from 13 and up, but not for younger children. And these services are to be designed to inform, guide, advise, and or support children within the target population. And also regarding a broad range of questions, from identity questions, sexual health and sexuality, violence and abuse, and other domestic or family-related challenges. So it's kind of a broad topic. And as I've mentioned, the target population were all children between 9 and 12. And we wanted to know both children have been in contact with such services and those who have not. So we decided on a 3-part project that aimed to first do a systematic review synthesizing Norwegian and international studies. And then for the second part, we wanted to map Norwegian services, and thirdly, perform interviews with the children. And I will get back into these parts as we go on. But the main research questions were what needs and wishes for, as well as experiences of information and support services does children 9 to 12 years old have, and included the children's own wishes for and needs and experiences, as well as service providers' experiences of children's needs and their perspectives on these. And we published 3 studies or reports. The first was the mixed method review, and then a mapping, and then a report on experiences. So for the first study, which was the systematic review, the inclusion criteria were children between 9 and 12 years old and service providers that do provide information and support services to children in the age span. And we wanted to include services developed to guide, advise, and give information to children within the age span, and where there's no need for a consent or referral from adults or other agencies. So where the children themselves could reach out and get in touch with the services. And we wanted to report data on the children's needs, their wishes for, and experiences with these services, as well as their views on the importance of the information and the services. So for the literature search, we searched for studies from the period 2015 until April 2024, and in several databases. For those interested, I can provide references afterwards. And in addition, we contacted all Nordic services that are part of the Child Helpline International Cooperation. And we identified more than 10,000 references. But after screening these references, we included only 5 studies from Norway, Sweden, Finland, Belgium, and Australia. Of these, 3 were qualitative studies and 2 quantitative cross-sectional studies, which is not much. So we decided on also including, or at least include for the discussion, 11 Nordic studies that we had identified, but which included a broader age span than the 9 to 12 years old. Both since they were from the Nordic context and that they could contribute to the discussion and also the evidence base. So what did we find in these studies? Collectively, they focused on both digital support services and school health services and social services in schools. They included children between 5 and 18 years old, which is a broader age span than the target population. But the studies either included a majority of children between 9 and 12, or they had separate data or analysis for this age span. And the results show that girls made the majority of inquiries to the services, and that there were kind of a broad span of contact forms, from face-to-face meetings and to digital channels such as phones, chats, and emails. And one of the studies actually showed that the majority of children preferred using phones rather than other forms of contact for making digital inquiries. Thematically, there was also kind of a broad span, and you can see that sexuality and terror are mentioned first, but that is mainly because 2 of the studies focused exclusively on either sexuality or terror and terrorism. But apart from that, they didn't have a single thematic focus, and focus on emotional challenges, mental health questions, family relations, violence and abuse outside of families, social relationships, and so on. So it was again a broad spectrum of themes. And on the question of what we did find, as you saw, we found few studies, and none of these studies actually included children between ages 9 and 12 years exclusively. And more importantly, none of the included studies had actually asked the children themselves directly and explicitly. So looking at the strengths and limitations of the services based on these studies, they highlight the importance of anonymity and the possibility of exploring topics on the children's own premises, and also that the children actually could end the conversations when they wanted to, especially when in conversations and made digitally by phone or chats. Weaknesses and limitations with the services based on these studies is that there's especially from the service provider's point of view, very challenges to follow up and refer the children further when they perceive that there's a need for that. Also, they wanted better training and preparation for their own staff. And for the service providers, especially, there was a challenge with abruptly ending conversations, especially when the topics had been, for instance, suicide or suicide ideas, because they didn't know why the children had actually ended the conversation, which could lead them to thinking very much about these children afterwards. So we went on to study 2, the mapping of the current services in Norway that also caters to the children between 9 and 12. And what we wanted to do was to map services that had been kind of quality tested and quality assured, but had been developed to let children here between birth and when they turn 18 to contact them on their own. And we did this mapping in 3 steps. First, by making a list of relevant services. And here we used Google, but also lists made by Norwegian authorities and kind of organizations catering to children with relevant needs. And then we gathered information about these services mainly through their own web pages, but also by calling them. And thirdly, we interviewed representatives and employees from a sample of these services. And then we made a SWOT analysis, kind of mapping strengths, weaknesses, opportunities, and threats within these services and for these services. And we identified 38 services. And these are the logos of some of them. They are youth phone, sex and society, for eating disorders, and they have several more or less narrow or broader thematic focuses, bullying and so on. And all these services were available for children between 9 and 12 years old, but not exclusively, I might add. So some information about the services. Age-wise, they were mostly targeting children and youth, although several of them also had no age limitations. There were more girls than boys actually reaching out to services. And the majority of the services were digital support services, where the children could contact them by phone, chat, email, or other messaging tools. Although 4 of them had also opportunities of face-to-face meetings. And 3 of them were public non-digital services like school health services and advisors at school, as well as yeah. And then life areas. And when we talk about life areas here, we mean kind of the topics or a categorization of topics that these services cover. And this is in Norwegian, but I will translate as we go. Because the first one is emotion, identity, and falling in love. The second column is family, friends, and free and leisure time. The third one is body, health, and sexuality. And then society, law, and rights, violence and abuse, and schoolwork, future. As you can see, the first one on emotions and identity is covered by most of the services, and family, friends secondly, and then body, health, and sexuality. So there's kind of a broad spectrum of themes covered by the services taken together. And then on number of inquiries, the Kors på halsen, which is the Red Cross phone in Norway, and also talk about bullying, are the ones with most inquiries. But I will also have to mention that of quite a few of the services lacked numbers for the age span or the youth or children that we actually wanted numbers on. And in the interviews with the service providers, they talked much about anonymity and confidentiality, and the point that children could call them or get in touch and be anonymous and not afraid that their information should be or could be spread further on. Children contacting them were also much interested in, or important to them was the questions on availability and accessibility. They wanted accessibility and available services where they could get in touch when they wanted to. And also for services available at school, they wanted to have them close at hand and get in touch when they needed. So they wanted services that were available 24/7, and or at least have kind of a broad time window for contact. The children were also, and the service providers also kind of underlined the importance of competence, either for education, but also in training before going into or talking to the children. And the service providers, interestingly, also were talked much about the burden and stress placed on the service providers, both emotionally, but also because of the organization and challenges with the capacity and worrying about cuts in resources or funding for the services. So that was the provider perspective. So study 2 on the mapping of the services added in-depth insights into the Norwegian context and the relevant services. And also compared to the studies we identified through the review, gave more insight into topics directly relevant to our research questions. And we also started to get a better view or understanding of target population, which were children between 9 and 12. And then I'll move quickly on to study 3 that I personally find the most interesting and perhaps the most important, and hopefully I will show why. What we did is that we did qualitative focus group interviews with 92 school children in the relevant age span from 8 different schools in different parts of Norway. And we wanted both an urban and rural districts. And in addition, we did 15 individual interviews and 2 group interviews with all in all 20 youth between 16 and 19 years old. And these were youth that had been in need for support or help when they had been between approximately 9 and 12 years. And we did these interviews to gain a better inkling of what services they had known about, used, and what they had missed when they were in the relevant age, and whether or not they thought that having available services would have made a difference. And through the interviews, we found that the children actually had very limited knowledge or even less experience with different and didn't really have needs and
You hear me? Yeah, the nickels. But my headphones cut. But yeah, the children
Sound
had
is
very
okay.
limited knowledge and little experience with services, but they did have many different needs and wishes that they expressed throughout the interviews. And also, quite a few of the children did not know where they could make the inquiries. And interestingly, that also applied to services that we might think they had close at hand, like the social and health services in school. So it was prevalent for both digital and more kind of face-to-face services. And when questioned about where they actually seek advice or support, most children mention their parents, or if not, other adults they know and trust. And the children had very different views on their preferences on ways of asking advice or support. And they also said that they had, or they expressed very different preferences when it came to ways of contacting services, both in person and digitally. So there was a huge variation. And they would also would like to be able to choose how to get in touch with them, and also who they wanted to communicate with based on gender, age, education, and experience of the service providers. So this means that they wanted very flexible services, and they wanted support services that could be reached 24/7, and which had large capacities and thus no waiting time. And they also wanted kind of social workers or services that would reach out to them and participate where they are, which means most of these services available at school every day. And they had many concerns about anonymity, which means the question on anonymity was very important for many children, although they had varying reasons for the importance of this. And one was that they had many worries related to sharing information about themselves. And since they didn't really know what happened to the information after, for instance, talking to an adult. So they wanted to control who had access to information about them. And I think the main thing is that study 3 actually added the voices and views of the children. And it showed us the variety in the children's needs and wishes. And although there were some tendencies when looking at age and the differences between 9 and 12 and between the genders and so on, there was also a variety between the children's within the same age group, between different boys, different girls, etc. So children in general are very different. And we also got a kind of a rich view on the children's own perspectives and lack of experience with information support services. So the question then is, do we have the whole picture? And what can be said all in all? Though I wouldn't say this is a limitation as such, it can be claimed that our study is not necessarily representative, since we haven't talked to all Norwegian children, but we have talked to quite a lot of children within the relevant age span. And we have talked to boys and girls and across several geographical regions. One important limitation, though, is that we have talked to very few children with ethnic minority backgrounds. And we were not able to interview children with specific challenges like mental or physical disabilities and so on. To kind of amend this situation, we were quite specific in trying to recruit youth from ethnic minority backgrounds. And that was quite successful, although we were not able to recruit anyone from the national minorities. We were able to recruit several youth with immigrant backgrounds. And although none of the children we actually talked to expressed that they had specific challenges. We can't rule out that they did not have challenges that were not visible, and that they choose or did not want to talk about this in the group formats. And there might also be the challenge of that the requirement of active parental consent might have influenced what children were allowed to participate in the interviews, as well as we did experience that the group size could influence that. When the group were between 5 and 6 children, some of them might have been a bit more quiet. Yeah, but all in all, I do think that we were able to gain valuable insights into children's needs and wishes. And I've touched upon this, but I'm kind of closing in on the end here. And in conclusion, we might say that support services targeting children between the age 9 and 12. They should offer both in-person and digital services, be flexible, and as a whole cover a broad spectrum of themes as well as forms of contact. And that means there's a need for both strengthening existing in-person face-to-face help services or support services, and for combining this with the development of digital support services in order to meet different and complex needs of these children in question. And also that school and in particular teachers are important for those children who do not dare to talk to their parents. And there's also a need for support services to make themselves known and available, and not only for the children, but also for significant adults in their children's environments. So there's a need for better visibility and availability. And on the question of anonymity, it really increases the chance of children contacting the services when they know that the person receiving them do not know who they are. But there is an important question or consequence that the anonymities of digital services makes it harder to intervene if the child is in acute danger or so on. And there's also the challenge of confidentiality, since there's only to a very limited degree that support and help that the services can support and help children below the age of 12 without informing the guardians. So that are the challenges. So to sum up or conclude, if we had done only the systematic review, we would have very limited knowledge about information and support services and how they might meet the needs of, in this case, Norwegian children between 9 and 12. So especially when there's little research done, adding primary research will add very valuable information and knowledge to strengthen the evidence on the question at hand. And our study too added important knowledge on the views of the service providers, and also knowledge about children within the age span actually contacting them. And importantly, our study number 3 added the children's own views and voices, which in this context might be the most important, since the services are to be developed for them. So using all three approaches, we got much richer and more nuanced evidence and several perspectives on the same question. So especially when there are few studies and the context within which the studies have been done, primary research on the same question or related topics might provide the most important knowledge and insights. Yeah, so that's about it. Thank you. I will stop sharing, and then hopefully I will see you and be available for questions and comments.